So if you've had a bypass surgery or an angioplasty done and you are worried about getting back to your physical capacity, and you're worried that if you exercise, something will happen, something will go wrong. After a bypass surgery and an angioplasty, we motivate people to go back to their physical capacity as much as possible and as much they are able to tolerate, depending on their clinical condition. Now, if you had come with a like before operation or before angioplasty, if you've had a stable angina, like if you were having chest pain while walking, which was relieved at rest, then you will be able to go back to your original physical capacity that you were walking at, and also more than that after a bypass surgery and angioplasty. But after a bypass surgery, I always motivate my patients to go back to their physical capacity in a graded fashion. They have to first start walking like 10 minutes, 5 to 10 minutes, and then increase gradually according to their capacity. And then at 4 to 6 weeks, they'll be able to go back to their original physical capacity. And before angioplasty, if the patient had come with stable angina, then immediately after angioplasty, we recommend that the patient should be good physical exercises in order to improve the outcomes. Apart from that, if the patient had a heart attack before a bypass surgery or an angioplasty, um, after a bypass surgery, I recommend patients same way, like go ahead in a graded fashion and increase duration of exercise, like starting from 10 minutes to 15 minutes to 20 minutes, depending on the physical capacity. And if they have some clinical condition, for example, like severe dysfunction or a heart failure or some other clinical condition where there is a recommendation to go easy on their exercises, the doctor will definitely recommend that to you. After angioplasty, also the same thing happens, like you have to increase the physical capacity in a graded fashion. But the bottom line is that you have to do physical exercises even after bypass surgery and angioplasty. They are mandatory. If you go back home and take bed rest, oh my God, that will be the end of it. That will be the end of the graft that I have placed in a bypass or a stent. So that will be the end of it. The clinical outcome is not good if you go back home and rest unless and until there is a clinical condition which asks you to take good bed rest after the procedure.